You are on the StartUpHealth Board of Directors. Talk to me about sort of what drew you to that project, because really it's a long-term journey that we're all on together, building these collaborative communities.
Yeah, I think the nice part about it is bringing together people with all different capabilities and different thinking to try and solve a problem. I think the best way to put it is we're all better together.
Yeah.
And sharing ideas, learning from each other, and this is how things ultimately get done. Very seldom does one person change the world.
Yeah. So part of the reason why we're having this conversation is you've been a big supporter of our T1D Moonshot Community.
Yes.
Helping to really lift up some of those innovators. Where do you feel like we are in the innovation life cycle within T1D?
I think it's exploding. We're here at a health conference, and the TD1 Moonshot is the talk of the town. I mean, It really is, because it affects so much. And we were lucky to spend time with the innovators that are part of the StartUpHealth Moonshot. And each one has such a unique perspective and is just cutting through in ways that needs to happen. And the fact that they're all collaborating with each other is game-changing.
So you're part of our T1D Moonshot Community.
I am.
What has it meant for you to be part of sort of a collaborative group passionate about type 1 diabetes?
It's really been amazing because, as a founder, working with esteemed scientists all day, it's great to have an entrepreneurial community to work with that has the same aligned mission, that understands what I'm doing, and really helps network into that community and beyond that community. And it's just been amazing, because you do feel alone sometimes as an entrepreneur, and you guys have helped a lot.
So from your perspective, why is it beneficial to have a more collaborative group thinking about type 1 diabetes?
So at its core, diabetes is a community. So when I think about community, it's one of these things where, and we just think about a patient or a person with diabetes, is every single decision that they make is critical. And especially for a type 1, where
every day
there's a life and death consequence to bad decisions, that's an unrealistic expectation on a patient. So really, when we talk about community, it's a situation where how do you have, people that are advocating for you, clinicians that are kind of tied in and understand insurances that care about ultimately your clinical outcomes, and obviously providers like ourselves that are innovating and introducing new technology. So it really takes that whole ecosystem to really make a difference and start to kind of shift the future of care.